Welcome to UMDF's Ask the Mito Doc monthly webcast. Tonight we will hear from a great panel of speakers, a moderated discussion to share impact and highlights from Mitochondrial Medicine 2022. Our speakers tonight include Dr. Amy Goldstein and Dr. Sonal Sharma from Children's Hospital of Philadelphia, Dr. Andrea Gropman from Children's National Hospital in DC, Dr. Kay Koenig from UT McGovern in Houston, Texas, and Dr. Lachman from the University of Miami in Miami, Florida. Our moderator is our very own Dr. Philip Yesky, UMDF Science and Alliance Officer. Our Ask the Mito Doc webcasts are made possible through the generosity of sponsors, so we ask that you join us in thanking the Edith Trees Charitable Trust, UCB, and Astellas Pharma for their ongoing support. If you haven't visited our new patient registry page, MitoShare, please check it out at umdf.org/MitoShare. If you missed Phil's 6-month update this afternoon, we will post the recording on our YouTube channel later this week. Make sure you check out MitoU. This is a great resource for patient families and our scientific and medical community. It provides you with helpful information on diagnosis, treatments, and will be continually updated with informational videos, including these Ask the Mito Doc webcasts. If you haven't seen our clinical trials page, make sure you check it out and try Mito Clinical Trials Finder. Explore and find the right trial for you at www.umdf.org/clinical-trials. We know you are seeking answers, and UMDF is always here to educate in difficult times and provide helpful resources and offer caring support. We can connect you with our patient concierge, or you can contact our support line at 888-900-6486. And our patient concierge representative will connect you with a local Mito family or a UMDF support ambassador from our national network of volunteers. Every month, UMDF provides an important resource, virtual support meetings. We invite you to scan here or visit the UMDF calendar for upcoming meetings. Join from the comfort of your own home for virtual support. Our fall walks have been well underway. Find a walk location near you at energyforlifewalk.org, and if nothing is in your area, join us for the National Virtual Walk this weekend. Mark your calendars now for UMDF Mitochondrial Medicine 2023 and join us in Charlotte, North Carolina, June 28th through July 1st. And the UMDF 2022 recordings are now available on the UMDF YouTube channel. Scan here or click the link in the chat window to check them out. We have muted the line, so if during the webcast you have a question, please use the Q&A button to type in your question so that we can get the answers for you. We ask that you keep questions short for this webcast. We may not be able to take questions that are too personal or detailed for this forum. Also note that we do have live transcription, closed captioning available, and you can turn it on or off as needed throughout the webcast. So without any further ado, let's get started with Dr. Phil Yesky.
Well, thanks, Kara, for that lovely introduction. Hello, everybody. Pleasure to be with you this evening. We're going to really focus in this Ask the Mito Doc on the impact and highlights of the Mitochondrial Medicine 2022. And it was the first time getting together in 3 years, thanks to the pandemic. And it was really exciting to be out there, see so many of you, meet with the researchers, clinicians, industry. We had 400 plus people together in Phoenix. It was 115 degrees outside the entire week, but it was lovely inside. And tonight, well, some 3 months later, we're going to work with our panelists to just get some comments on some of the highlights of the conference and share those with you. And along the way, as Kara shared in the introduction, please ask questions, use the Q&A function, and we'll do our best to answer as many of those as possible as they're appropriate. So without further ado, I'm going to ask our panelists to join us, and we'll do some quick introductions. We're really fortunate to have a great group of clinicians with us this evening. I think most of them are known to the community. There's a couple of new ones, but I think, again, Dr. Gropman from Children's National, Dr. Koenig from UT Houston, and Dr. Goldstein from Children's Hospital of Philadelphia, one of the veterans, if you will, of this community here, at least this webinar. But a couple of perhaps new faces as well. And I'd love to just give them each an opportunity to introduce themselves. So why don't we begin with Dr. Sharma from Children's Hospital of Philadelphia? Just tell our audience a little bit about yourself.
Thanks, Phil. I'm so glad I could join this session today. So I am a neurologist at CHOP, and I spend a lot of time in Mito Clinic as well. Coming out of pediatric neurology, I had the unique opportunity to do a year of fellowship with Mitochondrial Medicine. I was only the second fellow at CHOP. So I completely, am very grateful for the privilege of learning from people who've spent their entire lives working with these patients and families. So it's been a great journey so far. I'm learning every day with our patients.
Yeah, well, thank you for your commitment to our mitochondrial disease patient community. Our second relatively new addition to the community is Dr. Kumarie Latchman. Dr. Latchman, would you like to briefly introduce yourself?
Yes, sure. Thank you, Val. My name is Kumarie Latchman. I'm a clinical geneticist by training. About 3 years ago, I became interested in diagnosing and treating patients with mitochondrial disease, and I began working in the Mito lab. I did not do a formal fellowship, but I think it was pretty long hours of learning basic mitochondrial science. I've since started the first mitochondrial medicine clinic at University of Miami for the past 2.5 years, and it has been growing rapidly, especially with the exposure from UMDF.
Well, this is really great news for our community to see another clinic emerging, particularly in the south of Florida. And of course, all of our thoughts are with the Florida residents as this hurricane passes through. But glad you're doing okay and that you could join us this evening to be part of this panel. So so I'll start by just thanking all of you in advance for making time and being a part of this. We'll probably test our memories a little bit. It's 3 months since that symposium in Phoenix, but I really see this as a conversation, and we'll try to weave the questions in. And of course, my colleague Margaret Moore is also going to be on here. She's going to keep an eye on the Q&A and really make an effort to make the connection over to the family program where appropriate, so that we cover both tracks in this conversation. So with that, why don't we get started? First of all, we had two really excellent co-chairs, Dr. Bob Navio and Richard Haas from UC San Diego, who put the scientific program together. They've been active in this space for so long, and very generous with their time. It takes a lot of effort to pull a program like this together, and they really wanted to kick it off on our first day around directed gene and stem cell therapy. And so there were a number of talks around these approaches that, really move towards hinting towards cures as much as treatments. And that's really exciting, but it's important to kind of understand where the technology is and some of the challenges we face there. I'd be interested in the panel's thoughts on this. I thought one of the most interesting talks in that first section was actually by Dr. Bobby McFarland from Newcastle in the United Kingdom, who really talked about reproductive options for mitochondrial DNA disease patients. And this is a big topic, right, for our community, sort of a family planning topic, if you will. And I don't know, maybe Dr. Koenig, do you want to start with what are your thoughts there? I mean, Dr. McFarland really laid out sort of a full suite, and particularly in the UK, there are some very specialized techniques available that aren't available in the United States.
Yeah, thank you, Phil. And again, thank you so much for having me, and thanks so much for doing this for the families that couldn't make it to the conference. I was really super excited by Dr. McFarland's talk. One of the things that we struggle with as physicians is, again, talking with families who are interested in expanding their family. And for people who have mitochondrial DNA mutations in their family, it has been very difficult to provide both genetic counseling and to provide options for reproduction. And Dr. McFarland and his group have really had some amazing success in using some early reproductive techniques to help families be able to have children who are healthy and have low risk of passing on the mitochondrial DNA mutations. What I was particularly excited about, well, there's several things, but one is the success rate they're having, and two is that they are working to try and expand this, not just to people who live in the UK, but to a broader group of people. And so I'm really excited to see where this is going to go.
Yeah. Well, I was just going to say, I think one of the takeaways for me was that this is not a one size fits all right? That there are a number of techniques, there are a number of approaches, and it's dependent on the family situation, the nature of the mutation. Dr. Goldstein, I know this is an area that's been of interest to you as well. I don't know, did you want to maybe briefly summarize sort of mitochondrial replacement therapies? What is the cutting edge side of it that's going on in the UK?
Sure. I was just thinking as I was listening to Dr. Koenig respond to the last question. And I need to be able to say this. So I'm not trying to evade your question, Phil, but I'll get back to it in a moment. What really surprised me, I think we all know that when families have children, especially if the children pass away from Lee syndrome at a young age, there are a lot of families that, as we've said, want to expand their family and hopefully lower the risk of having such a severe phenotype or symptoms in their next children. But one of the things that surprised me, and I think that we've possibly underrated the impact this has on families, is that a number of the patients in the UK that were taking advantage of the mitochondrial reproductive technology techniques have LHON. And that, again, was really surprising to me. And I don't know why. I see like a couple other people are nodding. But I think that I've underestimated the impact that Leber's hereditary optic neuropathy have on families, because there are a number of families that were going to Newcastle for reproductive technology. I think, as we've said in general, this has just been an incredible couple of years as we've seen it evolve. And I think that we started off thinking this cannot be made available to US families. And then we had families that were able to get enough money together to travel to England, and then everything was happening there. And now they've been able to offer this, I think, to very select centers in the US, where if a couple's able to go have IVF and they have some embryos, the couple doesn't have to travel, the whole embryo doesn't have to travel. Now it's just one cell that has to travel over to the UK to have the genetic testing done, and to make sure that the embryos that have the least amount of risk are transferred back to help achieve a pregnancy. That's incredible. And, I know that we've all been asking the labs here, are you able to check these embryos for mitochondrial DNA mutations? And the labs in the US are not ready for this. So for right now, we're grateful that Newcastle is there and offering this to our families.
Yeah, so this pre-implantation genetic diagnosis, a very important technique. And Newcastle in the UK is also the first in the world to be approved for this mitochondrial replacement therapy, where now you're using donor mitochondria together with the mother's egg and nuclear DNA together with the father's DNA to try and inhibit this transfer of disease, right, from mother to child. Not yet approved in the United States. We're in a very unique situation there. It's somewhat of a legislative block, not a technical block. but it's not able to be advanced clinically in the United States at this time, but it is in the United Kingdom and then most recently in Australia. You're starting to see this take hold, and that's perhaps a little bit out on the horizon, but it definitely falls under the suite of technologies, right, that would, as I said, would describe family planning. And we've heard very clearly from our community, this is an area they want to hear more and learn more about. And I know working with Kara and thinking about our symposium next June in Charlotte, we're going to really try to build some component of family planning and mitochondrial disease into that, and really think about the resources we have available on our website as well to really reinforce this aspect of our disease community. So look forward to sharing more details with that as we go forward. The second platform of the day, Wednesday afternoon, was the Mitochondrial Medicine Society. So all of you members of the Mitochondrial Medicine Society. So this is really for the clinicians to organize talks that are more clinically oriented. That makes sense. So we had a number of great talks. As I look down through the program here, I thought the management of acute emergencies, right, is such an important one in mitochondrial disease. And maybe Dr. Koenig, again, I'm going to kind of, turn to you, but we certainly, get our other panelists involved here. But, so often this is in the Lee syndrome space, right, that this often pops up. Any takeaways from you? This was Dr. Mithal from Children's Hospital of Chicago that made this talk.
Yeah, one of the things that, one of the reasons we do these Mitochondrial Medicine Society platform sessions is to try and reach out to other physicians and really work with them to try not just to help patients at local mitochondrial centers, but to help patients all over. So we want to be able to reach those other physicians who are not necessarily mitochondrial specialists, but who have an interest. And so I really liked this talk. This was a great talk. One of the biggest concerns that our patients express to us is, I don't live in Houston or Philadelphia or Miami or close to my mitochondrial center. So what do I do in an emergency when my child gets sick or when I get sick? And so I really liked the ability to share that information with other physicians and share it in a way that was really high level and really provided a lot of good information on how to care for somebody in an ICU setting when you had a patient who was deteriorating with a mitochondrial crisis. What do you do in that setting? And that's the kind of talk that is going to be referred back to, listened to,
right,
looked at over and over again. And it's the kind of talk that one person hears and tells someone else and tells someone else and tells someone else about it. And so I think it was so impactful to be able to share that information among the clinicians that were there. And then what else it does is it sparks discussion among all the clinicians, right? So I see Dr. Goldstein nodding her head. We all start talking to each other. Well, this is what I do. What do you do? And it helps us really come up with best practice and how do we best manage patients when they're in these kind of situations.
Yeah, I know Dr. Goldstein actually gave a short talk at the end of this session, right, around trying to develop a protocol, if you will, for it. But that education component is so important, and maybe sometimes our patient family thinks it's about them learning or researchers learning, but this is a great place, right, for clinicians to get together and learn as well. And Dr. Lachman, again, starting a new clinic and maybe thinking about how you want to build up the clinic in Miami. Would you say talks like this are of great benefit to someone like you?
Definitely. I mean, I think this was a talk that really energized me to go back and pull more of my colleagues in. So I have pediatric neurologists too that are on board in the Mito clinic with me, adult neurologist, epilepsy neurologist, because I realized each of them had something unique to bring. And so some of my patients with seizure disorder will see the epileptologist, pediatric or adult. And I will ask them, do you need help managing? Do you need my help coordinating care? And I'm amazed actually at the willingness of other specialists to step in, as long as you invite and then you encourage and you also share your knowledge. Yeah. And it has been the greatest benefit, I think, that I've learned from UMDF is to collaborate, to network.
Yeah. I think it's, I'd like to think it's the hallmark of our community is that there's a lot of that collegiality and sharing and interest in collaborating. This is, of course, a very timely topic, right? As we go into fall here in the Northern Hemisphere. And Dr. Gropman, I know one of the main reasons that these patients end up in emergency rooms or needing acute care is due to a virus, right? To some kind of infection. So here we are, flu season approaching. COVID hasn't left us yet. I wondered if there's just any sort of general comments you might want to share just about where we're at with immunizations and infections in general with the mitochondrial disease patient community.
Yeah, I just wanted to backtrack a little bit on the previous topic to show how important it is to be proactive rather than reactive with patients. For example, I have a MELAS patient who thankfully successfully underwent an ACL repair today. So, having to educate an orthopedic surgeon about fluids and telling them what fluids they can't use, and, that we had to totally cancel the surgery and make it the first one in the morning because I didn't want the patient fasting that long. So I think that, having common guidelines established and having these scenarios prepared ahead of time instead of like, we're having surgery next week, what do we need to do? So I think it's really important, for clinicians to talk to one another and to include all the specialties, right? So we typically don't work as closely with certain subspecialists as others. And certainly with reproductive folks and OB-GYN, we haven't been working as closely because they're not at the front line. So I think it's important to include everybody in every possible scenario. So where are we with the flu and vaccine? So I can't speak for everyone across the country, but I know I've been working closely with the folks at NIH because they have an interest in vaccines. And so, we haven't had, knock on wood, any problems with our patients accepting the COVID vaccine, and the flu vaccine they get all the time anyway. We haven't had any adverse reactions to the COVID vaccine in our cohort of patients. Now, Peter McGuire and I have developed sort of like a mini prophylactic type protocol that we have the patients do ahead of time just to reduce the severity of symptoms if there were to be some from the vaccine. And we had one patient that we actually published on with MELAS who wasn't vaccinated at the time and how we managed her during her COVID infection. So I think, again, that whole concept of being proactive rather than reactive, right? So imagining what can happen and having a plan ahead of time. Of course, plans may need to be modified, but rather than having to scramble and assemble a plan at the time and alerting people. I think one of the most effective things that we do in our program is all of our fellows know about all of our patients and how to contact myself and another attending at any time. I mean, I've taken calls on a train and about to board a flight somewhere about a patient, and they have, things posted in the resident room about the patient with all of their emergency letters and where to find them. I think, it's easier now with the smartphones that the parents can just take a picture or scan in their letter. I say, don't assume anyone knows anything because they may not, and just show it to people. So I think so far the acceptance rate for the vaccines is okay. And hopefully, we're winding down in the pandemic, but we may not be. So
yeah, fingers crossed, right?
Yeah. Well, and Phil, I'd like to add here that in November we are going to Dr. McGuire is going to be talking to this group at our November Ask the Mito Doc about managing immune health and mitochondrial disease. So I think it's another opportunity for us kind of at a crucial time and with winter approaching to review those things with our families to make sure that they're prepared.
Yeah, really good point. And I know early in the pandemic, we worked with our scientific and medical advisory board to try to develop guidance, and it always came back to it's a very personal discussion between each patient and their caregiver, or excuse me, their healthcare provider, as to the appropriateness of the vaccine or whatever protocol is going to be used there. And I don't think anything has changed over those 2+ years. But really important to be aware and prepared. I think that's the message that came out of it. Now, this is a session. There were a lot of good topics. I'd like to touch on a couple others. One, there was a discussion about LHON therapies, right, and the development of treatments for LHON. I don't know if there's someone on the panel who sat in on that talk from Dr. Sadoun that maybe would like to kind of share their thoughts on where is the therapeutic development space with regards to LHON. Anybody want to throw their hand up on that one? Dr. Sharma?
Sure. Yeah, I think it was a really informative talk for me. It's always good to learn from those who are really the experts with that specific disease and see so many patients. I think that makes such a big difference with the rare diseases that we see. I was excited to learn kind of the things that I can counsel patients about. He talked about the 2021 open label study, the LEROS, and kind of went on to explain how they can see benefit even if they're starting the medication years after symptom onset, and just giving patients some statistically important data like that you can see improvement at 12 months continuing up to 24 months. So those are good talking points for me to take away as a clinician to give some reassurance to the patients we're seeing, and just learning about what's been going on with the trials with the intravitreal injections for gene therapy, the complications they faced with uveitis. I think all of that information was really important. Just learning about the new trial that he mentioned, the REFLECT trial, which I think they're going to start doing with bilateral injections. I think all of that information is what patients and parents want to know about when they come see us. And I feel like it was a great opportunity to learn those things.
Yeah, it really encapsulated the challenges, right, associated with gene therapy, right? That it's in some ways sounds so simple, right? To be able to just put the gene in that's either missing or broken and fix it. But it's really challenging to deliver it. You have immune aspects associated with it. And, again, my takeaway from that talk was it was a very balanced presentation. It was not, all gung-ho, but rather this is great, but we also have to acknowledge the challenges we're facing here in developing these therapies. And I think that's really important for the clinicians to hear, but of course for our patient families too, right? That there's a good sense of the reality of where LHON drug development is at. Yeah. So, and then the other talk I just wanted to kind of call out is Lee syndrome movement disorders, which I thought was interesting. And actually, I think Margaret, Dr. Koenig, this is actually a good connection over to the family side too, where for the first time we did a Lee syndrome focused session, right, associated with it. So, would someone like to maybe summarize the movement disorders with the Lee syndrome focus presentation?
I'd love to make some comments. So this talk was given by Dr. Nivedita Thakur, who I had the pleasure of training as a medical student, as a child neurology fellow, and then who joined my mitochondrial clinic and subsequently has moved to CHOP and is now working with Dr. Goldstein and Dr. Sharma. And she did a fellowship in movement disorders, and she is amazing. And she works in movement disorders. And when we had when we would see our Lee patients, we would notice the movement disorders that were occurring in them. And Dr. Tucker started working very closely with me on those patients and how to help minimize their movements to maximize their potential. And when she left me to go to CHOP, I always felt like she left a big hole because there is such a plethora of movements that are occurring in patients with Lee syndrome. And so I did talk with the rest of the MMS and said we wanted to bring her in to give this talk to help educate everyone and remind me of all of the wonderful things she knows about how to control movements in patients with Lee syndrome. And she really is continuing to be an amazing resource for me, and does on a continuing basis help me manage my patients, even from the other side of the country. But I think, for me, she always brings up the reminder that we do more than cure. We also treat on a daily basis, and we improve quality of life. And we make our patients more comfortable, happier, and better able to do the things that they want to do. And Dr. Tucker is, as I said, a wealth of knowledge of all different types of techniques, medications, therapies, and surgical procedures that can be done to help patients with a variety of different types of mitochondrial disease, not just Lee syndrome, but all types of mitochondrial disease, improve their quality of life. And I was just, as I always am, blown away by her talk.
Well, Dr. Koenig, I'd like to let everyone know that we had a special session this year, sponsored by PALS, the Lee syndrome multi-hour session. And want to let our patient community know that this is something that we hope to do more of, and also have an announcement that the recorded sessions are available on our YouTube channel, and that will appear in your chat in a minute. But Dr. Koenig, do you want to talk a little bit about what the Lee syndrome session was like with the families, and how you felt about that? And certainly we had tons of questions. I felt like it was a really engaging few hours.
Yeah, I always love the opportunity to engage and talk to families. Again, I feel like we're very fortunate. We live in Houston. There's a huge population here. And so there's a lot of people that do have access to us, but there are a lot of people that don't. And so the UMDF creates this wonderful space where people who don't have access to mitochondrial clinics are then able to come and get that knowledge and learn. And thank you again for all that you guys do. And I'll stop there with that. But it was a wonderful session. There were a lot of patients there with Lee syndrome, and we spent a lot of time talking about kind of the current advances in Lee syndrome. We talked some about the genetics. We talked about some of the pathophysiology of it. And then we talked a little bit more about the practicality of what do you do if your child has Lee syndrome, or you're an adult with Lee syndrome, because there are adults out there with Lee syndrome. And we talked about what a day-to-day life is like. What do you do in an emergency situation? Why do you do these things? I think one of the things that a lot of my parents always question is, why do we have to go to the emergency room when my child gets sick or when they have a fever? And so being able to explain that to them, or explain that to people in a setting that makes sense is very important. And so it was a really impactful way to be able to provide that information to people, and also to hear back from people and answer questions. So I did enjoy that opportunity.
Who is that?
Yeah, and as Margaret said, I think this is something that we really hope to continue and expand and offer more through our symposia and various meetings for that opportunity to go a little deeper on some topics. So one of the challenges of being moderator is you do have to keep things going along. We still have a lot of the meeting to cover. I just want to make sure we have a chance to touch upon all of them, and maybe we can circle back if there's more on any of these topics. And in that spirit, the next platform was Mitochondria in Space, which was really fascinating, but more basic. All right. I think if there was a one-line summary, it's like, we're not going to be spacefaring people unless we figure out how to protect our mitochondria, to radiation in space, et cetera. So some really interesting work going on there that may have impact for the mitochondrial disease community. And I've stayed in touch with some of the researchers in the space around that. But this was really about the more basic science, not so clinical at this stage. So let's move to platform 4. which is where I'm scrolling down here, clinical trial readiness and voice of patient. Yeah, so this was really interesting, right? And so we kicked it off with a presentation from Dr. Zuela Cunningham from CHOP, who talked about outcome measures, right? And the need for improved outcome measures. So who on the panel might like to kind of just summarize for our audience, where are we with outcome measures and mitochondrial disease? And I know that presentation was really focused on mitochondrial myopathies, and we have several trials, right, that are looking at mitochondrial myopathies right now. Dr. Goldstein, I see your hand sort of went up.
Yeah, I'd be happy to take this on. So Dr. Zuela Cunningham talked about the history of clinical trials, and Phil, as you just mentioned, a lot of the trials that have been done so far have been on mitochondrial myopathy. And anyone who's on this call who may have been involved in those trials knows that, you know, one of the biggest outcome measures that's been used so far is something called the 6-minute walk test. How far can you walk? How many meters in 6 minutes? And you compare that at your baseline before drug and then after you've been on drug. And of course, the best trials, you don't know if you've been on drug, you might be getting placebo. And one of the questions that comes up is, you know, is that really the best measure of if somebody's doing better on a drug? And so Dr. Zuela Cunningham has put together something that she calls the MM-COAST, which is a composite score using patient-reported outcome measures. So how is the patient feeling, functioning? What's the quality of life of that person? Any caregiver stress-related issues? So a lot of different surveys, and that's combined with some different physical therapy measurements. And these are things that we've really been working on hard at CHOP. So we have people that not only do a 6-minute walk, but also do some myometry, so squeezing and figuring out how many pounds of pressure can you put on a weight with your hand grip or your shoulder shrug or your legs, and then some other fine motor dexterity tests. So we use like a peg test where you flip pegs over or fill pegs in, a sit to stand test, and I think the beauty of her score is that we're not just looking at each one of these things as an individual outcome, but it's really the composite score. Mm-hmm. So how does the quality of life improve if you're able to not only walk a little bit more distance, but also perform better at sit to stand or some of these other outcomes? So that is, you know, kind of what one of the concept of having a composite score, I think we've all been waiting for. And again, this is really geared towards adults with mitochondrial myopathy. But through some of our other efforts, Phil, like the Lee Syndrome Roadmap Project, right, we also want to be looking at composite scores so that we really can tell if people are doing better. Now, why is this important? This is important because there's still no FDA approved drug, and the FDA needs to see evidence. And they don't want to just see that we can help somebody walk 5 more meters. They want to see that this is actually mattering in people's lives. So having that composite score, doing the patient-reported outcome measures, it's vitally important that we show that a drug improves all of this, the whole composite score, in order to get drugs approved. And so it's very exciting progress.
Yeah, and I would say importantly, they're very patient-centric. Like you talked about improving quality of life. Right. So it's not measuring something to measuring something like a lactate level or something like that. Right. But rather, you know, out of this composite, what are the aspects, right, that are being measured that are most meaningful to the patient? This is a great direction of, you know, of more patient centric drug development. That's really important to the FDA. And we had a presentation right after that virtually from a representative, Dr. Choi, who kind of gave the large rare disease perspective, right, of the FDA. And, you know, I think we heard a lot of comments that were supportive of this approach that you just described, right, Dr. Goldstein, of, you know, they're open to the ideas of building these composite scores. Dr. Gropman, I know you're involved with clinical trials, and not just in mitochondrial disease, but other rare neurological diseases. I wonder, maybe you could kind of put things in perspective about where we're at with mitochondrial disease therapeutic development and having outcome measures, compared to some other communities you've worked with.
Yeah, so I think we have the same issue. For example, in urea cycle disorders, I do a lot of imaging studies. And there's not just one imaging study that really tells the whole picture, but it's really the composite of multiple studies, but it may not be a one-to-one association. So in other words, trying to understand, is there, are certain tests weighted more heavily in terms of either disease association or outcome versus another? And, this is something that's probably going to require more sophisticated mathematical modeling, machine learning, things like that, to put together a composite score. The problem is, the FDA is sort of not on board yet or ready for this type of thing, because they're used to a linear, you have one measure and it means one thing. And the concept of having, a more complex or weighted average of different measures is something new. And a lot of these are not necessarily qualified already as standardized biomarkers for clinical trials. So I think it's an education process on both sides. Like, we can build the tools, but they have to meet us halfway to be able to accept them.
Yeah, that was actually, that was my takeaway, that it's educating the FDA, right, on mitochondrial disease, but we also have to be educated on where they're willing to draw the lines in terms of what they're able to accept, and that just requires ongoing dialogue. We have about 15 minutes left, and I know
Dr. Koenig, I see you have your hand raised.
Oh yeah, of course.
Yeah, I'm sorry. Okay, and I'll try to be quick, Phil. So I just want to say, because I've been having conversations with people about this in the last few days. So I think one of the points that I want to bring up that is also really important in relation to this is that we are making progress. So clinical trial readiness involves figuring out what these endpoints are. And part of the reason that we are not having successful trials right now is not necessarily that the medicines we're trying aren't working. Some of it, not all of it, some of it is related to not having the right endpoints. And so one of the things we've seen, or I've seen, is that we have a lot of what we call patient fatigue, clinical trial fatigue, patients who have done clinical trials and said, well, that didn't work, and so I'm not going to do it anymore. Yes. And I just want to say, I'm not giving up. I don't want anyone else to give up either, because every time we do a clinical trial, we learn more. We learn more about whether or not an endpoint works. We learn more about whether or not a therapy works. So, there are examples, and I'm not going to name any companies, but there are examples of trials that have been done that have led to another trial with the same drug. Yeah. We wouldn't be doing another trial with the same drug if we didn't think the drug worked. Right. We think the drug works. We just need to make sure we're finding the right endpoint. And so I just have to say, we have to keep trying. And I know that it's really frustrating when you invest so much time and effort and hope into a therapy or a clinical trial as a patient. We're investing that too as doctors and researchers, but we have to keep trying because we are going to get there.
Yeah, really important points. And actually, it's perfect segue, Kara, if you wouldn't mind bringing up the slides here. We, following these talks from the FDA and from Drs. O'Kipley Cunningham, we actually ran a session on clinical trial readiness because we wanted to have a very open conversation from patient perspective, clinician perspective, industry perspective, as to understanding what are the barriers to being successful in moving clinical trials forward. So in advance of the symposium, we actually did some surveying, and some of you may have participated in it, but we covered all those stakeholders. Next slide. It was all done electronically. The surveys were made available. We collected it over approximately a 2-week period. And then we tried to collate those data. And I thought I'd quickly share some of the findings here. And if anybody has any comments from our panel, next slide, please. Yeah, so if there's one takeaway, clinical trial recruitment is challenging, right? And will continue to be. And that leads to longer delays. Sometimes it leads to trials being stopped, smaller sample sizes, so that reduces the power of the trial. And then we're not as certain about the effect. These are challenges, not unique just the mitochondrial disease, but in general. But we need to be aware of them and think about what we can do. So the next slides overall across those three groups, we've actually have a couple posters on this that we presented. I think we're going to try to write this up because I think the community would find it really interesting. But there were some commonalities across all those groups, right? Travel, transportation for patients and caregivers, even being aware that oftentimes that's paid for, just not being aware of it. We have to do more to educate there. Having more sites available, right, is the recognition that it might be really hard for patients to travel a long distance. Not knowing how to find the clinical trials. In the introduction, Kara told us about the UMDF clinical trial finder and just being able to find studies that may be relevant to you and then have a conversation with your healthcare provider about participating in it. Not having time to participate and not likely to qualify as being concerned. So these were things that kind of came out overall from those three groups. And I think on the next slide, Kara, there's one more. Like going forward, right, we're going to have more conversation about so-called decentralized trials, like can you have remote participation in some way, improving communication. Boy, we come back to that all the time, right, about improving communication across all those stakeholders, transportation, ensuring that advocacy groups like UMDF and others are partnered with the clinicians and making them aware of the trials that are out there and getting their involvement with it. It's a big concern that the patients worry that they may not have access to the drug when the trial ends. So this is open label extensions or something to be discussed. And of course, this increased awareness. So these were some of the general findings from that. And I know many of you were in the room as that was taking place, and it was actually quite powerful, right? I thought it was a very open discussion. No finger pointing, but just this is more like what I'm feeling, right? Around this. And Dr. Koenig, you brought one up that just, this feeling of sort of being resigned to, I'm not sure if clinical trials are ever going to do anything for us. So we have to overcome that. Anybody else have any thoughts from that discussion that really stood out to them from the clinical trial readiness session?
I can make a quick comment, only that it really pushed me forward to want to start a natural history study for the mostly Spanish-speaking population in Miami. And so we started that just to try to understand what happens in those patients with mitochondrial disease.
Yeah, increased diversity, right, in our clinical research, really important going forward too, for sure.
One of the things that stood out to me from families when they mentioned how hesitant they are to have to stop the supplements or the medications that their children already are on to be able to participate in trials, and how that was a barrier for them. I feel like that is a learning point for us in terms of when we're designing trials, how we can incorporate that to allow more families to participate.
Yeah, I agree. And just recognizing that every data point is so valuable, right? That we have to find ways to collect that and be able to share it, right? After the trials are complete, to make sure we can design even better trials than in the future. It was a really. I'm really glad we did that the way we did, where it was just sort of pass the microphone and let everybody talk, because I think a lot of interesting things came out from that. Really, one more platform, and Dr. Goldstein, I think you offered to make a couple of comments. It was focused on autism and the role of mitochondria, right, inside of autism. And I know you were a participant in it. Maybe you could share just a few of the highlights of that session.
Oh boy, I knew I should have reviewed my slides today, Phil.
Well, that's a while ago.
Well, I had the pleasure of trying to recap that session for the families. And I will tell you that anytime the UMDF asked me to do a recap of a scientific session that I then have to present to the families, I'm paying extra hard attention and making slides when I do it. No, this session was really fabulous. There were a lot of people that stood out in this session, and I'm going to forget everybody who participated. There were quite a few speakers. Of course, it started off with Bob Navio. And it's always great to hear Dr. Navio speak about autism and his Suramin trials and how things are moving along in his research. Pat Levitt gave an excellent talk. As I said, there were a few other speakers. I think, no one, I want to make sure that what's very clear is that no one who spoke was a mitochondrial expert except for Dr. Navio. Everybody else came from the field of autism and shared what they were, what their research is focusing on, what aspect of autism they're working on, and exploring mitochondrial dysfunction. In the world of autism, we really didn't talk specifically about individual mitochondrial disorders and how autism might be a symptom. But the research that's being done is fascinating. Everything from, improving socialization, improving language, right. Decreasing some of the neurobehaviors. And, it was really cutting edge research that a lot of the people who spoke were coming from developmental pediatrics fields. And it was, again, really fascinating for me to hear what everybody had to say. Again, I think that for me, the biggest take home is, and Bob Navio, I think, is just such a good example of this. When we start looking at how can we repurpose drugs and use them, he found this drug that is used in African sleeping sickness and thought maybe there's something here that I can use. Knowing what this drug is doing, maybe we can activate some different pathways that might help children with autism. And, seeing his before and after movies of some of the boys who were able to start speaking after getting the treatment it's always very heartwarming. So it's good to touch base and see what he's up to, and hopefully he'll continue to make some more breakthroughs.
Great. Thank you for that, Dr. Goldstein. It was really interesting, and it speaks to this horizontal nature, right, of mitochondrial function across many diseases, health, right? Every human on the face of the earth should be concerned about keeping their mitochondria healthy for healthy aging. So it's really interesting, the tentacles that come back to mitochondrial disease around that, autism being one of them. Well, we're getting close to the end of the hour. We don't have any questions in there. Again, if you have a question, use the Q&A. This is a good chance to pop it in there. There was one question around mitochondrial dysfunction and how it might relate to long COVID. I have a feeling that could open up a very long discussion. I don't know if there's any of the clinicians here that maybe quickly.
Well, and Phil, I do want to make sure everyone knows that if your question wasn't answered, we will do our very best to get them answered post-event. But that certainly was an interesting one that you bring up about the long COVID, Phil.
Yeah, but maybe it's good to kind of put that on the shelf for the Peter McGuire presentation, right, in a couple of weeks, because he can really speak to that very clearly. Few minutes left. Why don't we go around the horn with the panelists? Somebody has to go first. Dr. Goldstein, I'm going to start with you, but everybody else be ready. Just what did this meeting mean to you, right? Particularly since we hadn't been together in 3 years. What were really left upon you, since we're trying to talk about highlights in general?
Sure. Wow. It was amazing to be back together in person. It's always wonderful to see each other, the clinicians, and share information. There's a whole lot that's happening in the hallways and, after the talks that are going on in terms of collaborations, asking each other's opinions, showing each other MRIs. It's a very small, tight, close community of clinicians. And I'm just really happy to be working where I'm working, but having the community around me that I have. It was great to see all the UMDF members there. And of course, the patients and families that were able to attend. For me, one of the highlights is spending time with the teens, because I usually do a little Q&A with them, and they get a chance to ask me questions without parents in the room. And I never repeat what they ask me, so don't ask me.
It's in the vault.
It's in the vault. But it is one of my favorite parts of the meeting, because the teens, they really get so much from being with each other. And for a lot of the teens that are able to come to the meeting, sometimes it's the first time they meet another teenager with mitochondrial disease. Yeah. And just watching them bond over the course of the week is phenomenal.
Wow. Thank you, Dr. Goldstein. And Dr. Gropman, I know you have a hard stop. I want to make sure you have an opportunity and share any additional thoughts you had from the meeting.
Yeah, so I think, it was more of coming together. We've been isolated for so long during the pandemic, both clinicians and families and clinicians, that it was very therapeutic for many of us. And I always enjoy the meetings within the meetings. So in other words, like the hallway meetings and speaking to families is always very insightful to me. And I learn a lot, and sometimes more than I do sitting in the sessions, to make sure that we're on the right track, that, the family voice is very important, and that we're addressing the questions that are important to them. I think there was also progress made, despite the fact that we thought we didn't do anything during the pandemic. Right. And hope. I think the most important thing was hope for the future, and that, we're all still in the same boat and working together. And, it might be slow going, but we're going in the right direction.
Well, I appreciate you mentioning that. I left inspired, right, and full of hope. And I think that's part of what comes out of coming together and not just being in these little windows here on Zoom. Dr. Latchman, perhaps for you, again, really trying to start this new clinic, in Miami. What were you left with as an impression?
I think, first of all, I was really inspired by the courage of the patients that came, how they were able to come and listen to us talk and looking for answers. And I felt their desperation in the family meetings. I felt their longing for treatment. And for me, it just made me want to do it better, faster, more efficiently. And it was a very emotional connection that I had. And it made me realize that I'm doing exactly what I need to be doing professionally.
Wow, fantastic.
And that was amazing for me to leave. It was only my second UMDF. And for me, it was every year I want to be there. Every year I want to leave wanting to do more.
Yeah, that's fantastic. And again, thank you for your dedication to the mitochondrial disease community. Dr. Sharma, for you.
I think similarly, just being a part of the family sessions was really eye-opening for me. We see patients and families in a slightly different context when we meet them in the hospital and clinic visits. Your questions are very pointed. You're always pressed for time. You're always trying to answer a pertinent question that's related to, whatever problem is going on that time. Meeting families outside of that context and just kind of learning their day-to-day struggles that they don't really share with us when they are in clinic for those 40 minutes, right? That was really eye-opening for me. And I felt like I went back with more ideas about what I can do better for the patients I'm seeing, for the families I'm seeing. It definitely gave me more energy to, get back into work and try and do more productive clinical research. For this, just watching everyone present their work is so encouraging and inspiring. I think it definitely puts you into, and it just helps you accelerate whatever you're working on.
You made a great pitch, right? For those who may be watching this webinar and haven't been to one of the national symposium, it's a really nice opportunity to interact with the clinician community in a different way than in the clinic itself. So I thank you for bringing that up. That leaves the final word to you, Dr. Koenig. How did you leave Phoenix other than probably tired and ready to get home?
And I will be brief because I know we are out of time, but I just want to say that for me, I remember when the pandemic first started and we first started having virtual meetings, thinking how awesome it was to be able to connect with people all over the world and not have to travel, and to be able to stay home and be with my family and still be able to have these meetings. And then about halfway through, I realized that I was missing something very important, and that was that personal connection. The hallway talks that everyone's talked about, the personal interaction, the interaction with the patients, that stimulation, that feeling of accomplishment, and that inspiration that you get from being at a meeting like this. And when I went back this year to the UMDF after too many years away from everybody, I walked away from there remembering why we have in-person meetings and not just virtual meetings. And there is a place for meetings like this. And it's wonderful that we have this whole virtual technology now, and that it does still bring us all together. But there's nothing that compares to that feeling of presence and unity and shared purpose of being at the same place at the same time, working for a common cause, which is mitochondrial disease. So thank you to the UMDF for putting this together every year and bringing us together.
Yeah, thank you. And so thank you to all the panelists. You know, we have a number of virtual meetings to still move through, some of which you see here coming up in October, November, and December for Ask the Mito Doc. We're also planning on doing another clinical trial update in December. We'll get the details together on that because things are changing so fast. We don't want to wait a year to come back and provide an update to the patient community. But next June, we'll be in Charlotte. I know Margaret is very excited about that. We're going to be in her hometown there where she's living. And we really look forward to seeing everybody in person and building upon all the successes of the meeting in Phoenix. Thank you, all the panelists, for your time, for your insights. Thank you to the audience for joining us tonight, for the questions, for the UMDF team and supporting this. And we'll look forward to seeing you at a future Ask the Mito Doc.